Women with dense breasts know the challenge of getting clear results from a mammogram. Now there's another option. Dr. Donna Plecha has joined us in the UH Broadcast Center to explain. Dr. Plecha is the Director of Breast Imaging at the Breast Health Services in Seidman Cancer Center here at University Hospitals. So welcome back to the show.
Thank you.
Now, many women with dense breasts have a mammogram, but they end up having to go back and get more screenings, right?
Right. So that's really a patient's option. A woman's option is to get more screening because we know that mammograms have a hard time finding cancer in dense breasts. So having more additional testing may be helpful.
Okay, so is the screening that we're talking about a 3D mammography kind of imaging?
Well, some people consider 3D mammography supplemental or additional screening. I kind of think of it as the best mammogram we can offer. On top of that, there's other studies that you can get done, such as a screening ultrasound, or something new we're offering at University Hospitals is fast MRI of the breast.
Okay, well tell us about that option.
So that option is a MRI scan which is done in about 10 minutes, and it does require an IV contrast to be given to the patient. And recent studies have found that it picks up many more cancers than even the 3D mammogram or the ultrasound. So it's something we decided to offer to patients as a choice for them.
Okay, so it can pick up more things. Are there downsides to having it? I mean, if it picks up more cancers and things, does it pick up other things that maybe aren't so great?
Absolutely.
Aren't so dangerous?
Right. It may pick up things that aren't cancer, right? So that's called a false positive. So it may pick up other things that may lead to additional testing, just as any screening exam can do. So that is one of the things that patients have to weigh. If that's something they're willing to accept, then they may want to try and get the scan to try and pick up more cancers.
Okay, is it a regular MRI where you're in the little tube and it's banging around you?
It is, but it's less than the normal MRI of a breast is about 45 minutes long.
Oh my goodness.
This is only 10 minutes long.
Can seem like an eternity for somebody who's a little bit claustrophobic.
Yes, it can.
So it's
only 10 minutes, and also it's a self-pay exam.
So insurance won't cover it up?
Insurance will not cover it. It's $250 self-pay.
Well, it's not bad, just to be sure. Huh?
It's really not bad compared to the cost of a regular MRI.
Okay. And is there any particular women that you would recommend for this kind of a screening?
So I think any woman who's interested in additional screening should consider it, especially those patients with dense breasts. Even patients that have a normal risk for breast cancer, they can benefit from this, according to the studies that have been done.
So the advantages outweigh those disadvantages?
I think so.
All right. Great new tip.
Thank you.
When fighting breast cancer, knowledge is your first weapon, and the Fast Breast MRI is a great one to include in your arsenal. To find out more, use the information that's coming up next. My thanks to Dr. Plecha for joining us today.
Thank you.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE, that's 5433, or visit www.uhhospitals.org/lifelonghealth.